Hi, this is Josh from pharmacisttips.com here today to tell you a little bit about the medication Montelukast. I'm going to touch on the uses, the dosage, and the side effects of this common medication. First off, what is Montelukast? It's what's known as a leukotriene receptor antagonist. It blocks the effect of leukotrienes. Well, what does that mean? That they cause allergy and asthma symptoms. They're released in the body during the allergic reaction or an asthma attack. Those things can cause inflammation in the airways, the difficulty breathing, the wheezing, runniness in the nose, and things like that. In the US, it's sold under the brand name Singular. So what are some of the uses? Allergic rhinitis, that's medical speak, for those allergy symptoms, runny, stuffy nose, itchy, red eyes, all that included with the allergies. Asthma prevention is used to prevent asthma. It doesn't replace any other medications. You would still need a rescue inhaler or possibly steroid inhalers. This would be added on. It's typically not going to be used to replace anything. Atopic dermatitis. This is what's called an off-label use. It wasn't initially studied for this, but they found it can sometimes help with itchy red rashes. May not improve the rash much itself, but it often helps with the itchiness associated with the rash. In chronic hives, sometimes it is again used off-label for that, simply because it blocks a portion of the reaction that happens in the body when you have allergic reactions. So what's the dosage? The standard adult dose is 10 milligrams a day with or without food. For asthma, it's taken in the evening. Allergic rhinitis, any time of day, usually morning or night. Children, anywhere from 4 to 5 milligrams a day. Now, this medicine is available in chewable tablets as well as granules. Granules are just, it's like a powder mixed with a small amount of soft food or liquid, and then the child drinks once a day. When used for preventing exercise-induced asthma, it's usually dosed 2 hours before an activity. So what's the deal? Why do you have to take it at night for asthma? The initial studies showed it was most effective. They dosed it at night and it was found to be effective. So that's what we continue to recommend. There haven't been any large comparative studies, morning versus evening dose. Now, we've found for allergic rhinitis, it seems to work morning or evening. So it is recommended you take it at night for asthma. But if you're always missing your evening dose and you think you could take it in the morning, remember it better in the morning. It'd certainly be worth the time to chat with your doctor and see if they'd be willing for you to switch. I think for most people it would be best to take it in the morning than to take it occasionally in the evening, because daily use is going to provide the most effect with this. So that would certainly be worth chatting with your doctor about. Some of the side effects, as a whole, Montelukast tolerated really well. Very few people seem to have problems with it, but you can get your standard headache, dizziness, fatigue, rash, some mild liver effects, or some indigestion. Now these are rare or serious, so we can see some behavior changes or suicidal thoughts. Again, super rare, but we do have to warn about them. Occasional liver problems or aggressive behavior. All those things, if any of that were to happen, you'd want to contact your doctor right away and let them know. I do appreciate you watching this video. I hope you found this information useful. Again, talk to your doctor if you have any problems, any questions about the dosing, it's not controlling your asthma, your symptoms getting worse. Please follow up. Subscribe to my channel. I appreciate it if you like my videos. And thanks again for watching.